Well, I have three cases I want to show you today, so right after one, there'll come another one for a total of three. This is the first case. It's a puppy with a very swollen face, and it's called puppy strangles or juvenile cellulitis. And the puppy's face that get this are just about as swollen as you can get and have scabs and pus coming out of wounds. They're very painful and very sick, and they have a fever. Because it's an immune problem, puppies often need antibiotics and cortisone, prednisones, or dexamethasone to make it better. And you'll see they used to call it strangles because underneath the puppy's jaw you'll see this huge swelling that used to actually cause problems breathing, and that's why I call it puppy strangles. But with some cortisones and some antibiotics, usually most of them will get better. Try to treat them just as soon as we can, because the longer you wait, the more scarring and the harder the infection is to control. The second thing I want to talk about is lick granulomas. These raised ulcerated circular lesions are characteristically caused by a dog that just won't quit licking the area on both legs or one leg right around the wrist area. These type of lesions can be caused by pain, shooting down the legs, or itchy skin that just won't, the dog can't get back to where it really itches, so they just lick their legs, and they lick until they have these sores. Dogs that are hypervigilant or very anxiety prone also lick because it's very soothing. It releases endorphins and calms them down. So those dogs we need to treat with Prozac. If a dog's painful, like this dog was painful in the hips, and he licked his legs and it caused the lick granulomas, we treat with pain relievers. The cause of the lick granulomas, being anxiety or pain, needs to be taken into account when we treat the dogs. The next case is a rottweiler that was just having a heck of a time walking. If you watch the video, you'll notice he looks like he's drunk when he's walking. He doesn't really know where his hind legs are. He has ataxia, which is basically staggering around on the hind end. His front end is very strong, and he's not really in that much pain, but his hind end just is not working right. And I wanted to show you this so that you know the difference. When a dog limps because it's hurt himself, that's different from a dog that is strong up front, but his hind end is uncoordinated and weak. And that's what's wrong with this dog. And we see it in some dogs that have spinal problems in their neck, in their chest, or in their back. And it's not hip dysplasia, and it's not other joint problems, but it actually is a spinal problem. So if we look at the skeleton and you look at the neck area, you can see the cervical vertebrae, or those vertebrae associated with the neck, between the chest and the head. And if you look at the x-ray, you'll see the orange arrows are the places where there's arthritis, and the green arrows on the far right is where there's narrowing. So these vertebrae are not normal, and the disc spaces, or the spacers between the vertebrae, are actually getting they're defective, and they're getting worn down, and they press up against the spinal cord, and you'll see the spinal cord goes right through the vertebrae. And if the disc pushes on it and pushes straight up on the spinal cord, there's no pain, but the nerve impulses just don't go straight through. And what happens is the dog doesn't know where his hind feet are, and that's what's what's happening in this Rottweiler. And it's called wobbler syndrome. It's caused intervertebral disc disease, and by lots of names. But this is just something that happens, and I wanted to show it to you. He's happy. He wants to keep going. His back end just doesn't cooperate. But it's a good dog. Well, I hope you enjoyed this little videos of the puppy strangles and the lick granulomas and the wobbler dog with the, arthritis and disc problems in its neck. I hope your dog is healthy, and to keep it healthy, make sure you don't feed it too many of those allergenic treats, and give it more oils and feed it the right food. That's what my book, Dog Dish Diet, is about. It's about feeding your dog the right ingredients to give it a healthy life.